Uganda has 731 new HIV infections every week. If this doesn't ring a bell to you, let's go down further, because the 2023 HIV fact sheet shows that 40% of all new infections are among young people. In 2023, there were 38,000 new infections. 15,000 were young people between the age of 15 and 24, 3,000 young men, and 12,000 young women. This simply means that 4 of every 5 adolescent girls make up the country's new infections. Why is this the case? Dr. Daniel Byamukama, the head of HIV prevention at the Uganda AIDS Commission, explains.
45% can contract HIV out of ignorance. As communities, we have let the girls down. We still let the girls get married at a young age. It's a community issue. In spite of the laws on the books, more than 30% of girls will be married off while they are still young, before they are 18. We think sexual violence contributes significantly to putting the girls at risk, and we call upon all stakeholders, especially community leaders, to provide these girls with information.
This is partly what is driving the challenges towards meeting the second 95 target, to have every person who tests positive for HIV on treatment.
A good number of people who are living with HIV are fearing to come for HIV testing, especially men and especially children. A significant number drop off treatment. They abandon treatment, which results in HIV transmission during breastfeeding or during pregnancy. Why do they drop off treatment? We still believe it has everything to do with stigma.
The target by government now is to accelerate testing and having those positive enroll on treatment. But how different will this be done?
The Ministry of Health is doing everything possible to increase innovations on making sure all children who are infected at birth are identified and they are enrolled on treatment and supported. And also men, the Ministry of Health is implementing various innovations on reaching men to make sure they are tested and offered those who are found positive, initiated on treatment, to make sure we don't default on our 2025 commitment.
Government has also introduced HIV prevention drugs, pre-exposure prophylaxis or PrEP, for fishing communities, sex workers, and those at a high risk of contracting HIV.
The first one are pills. The second one, they are injections, which are taken every 2 months. And the third one is a ring which women insert in their private parts. We call it a vaginal ring, which lasts for 1 month. This program has been running in the country for quite some time, more than 5 years. Our state has not performed substantially, contributed substantially, because we are targeting a few people. Since the program started, we have reached, I think, close to 700,000 people, only 700,000.
However, the same government is unable to finance the continuous supply of these preventive drugs.
We do not have enough money to buy enough PrEP doses, enough doses for pre-exposure prophylaxis to meet the demand for everybody. And as such, we have not promoted this program nationally.
The issue of funding is actually a bigger problem, because Uganda could only finance 14% of the required $836 million, slightly over 3 trillion shillings in 2023. Uganda only raised 299.7 billion shillings.
Right now, out of about 65 districts which have a high burden of new HIV infections among girls, we have money to reach only 45 districts. That means the other high burden 20 districts, we don't have money for committed prevention programs that make sense to young women.
This problem is yet to be resolved, because the plan to raise money through an AIDS trust fund was rejected by the finance ministry.
The question they asked, are we going to have cancer fund? Are we going to have malaria fund? Are we going to have, sickle cell fund? Are we going? All these questions started coming up, and then therefore, after some time, finance notified us that we could not operationalize this. But for us in health, we would have loved to see this.
And indeed, from an economist's point of view, the trust fund is a constrained fund.
Any economist, any finance manager would want to have free space to determine where money should go, depending on the emerging needs or the pressing needs. Now, you don't want to pack $2 million in an HIV/AIDS fund, and you're still working on a plan on how to use it, and then you have River Nyamwamba has washed away bridge, and you can't use that money.
If we prioritize health in the budget, again, and we allocate 10% to 12%, or even increase it to 15% of the national budget, we could be able to get an additional $2.6 billion, 3.7 billion, or 7.7 billion.
It is now clear that the 2025 95 targets for elimination of HIV as a public health threat will not be met in Uganda. But what remains important is your individual input towards ending HIV. What are you doing about it? Ask yourself. Walter Mwesigye, NTV.